The Centers for Disease Control told all states last week to get ready to distribute a vaccine for COVID as soon as November 1st. Hawaii's Department of Health has yet to decide who will take the lead in developing the process. Gina Mangieri is always investigating and reports on calls to get a head start.
I found many states already had planning underway, but Hawaii's health department says they're reviewing the CDC guidance. Lawmakers say get the logistics in place ASAP. Limited COVID-19 vaccine doses may be available by as early as November, with the supply increasing substantially in 2021. That's what the CDC told all 50 states in an urgent request to have a plan in place in October for what the director calls fully operational distribution. The State Department of Health told Always Investigating they got the CDC's guidance last Thursday and are still reviewing it carefully and evaluating the next steps. They add, developing the process will take some time due to still many unknowns and may be led by a select group of experts or a task force or an experienced individual. This as several other states already have vaccine distribution planning processes well underway.
Are we going to continue to just be reactive, slow on the take, late to the game, or are we going to be able to get ahead of this and start to put a team in charge of building out infrastructure, capacity, logistics, so that we can handle and deal with the pandemic a lot more effectively?
There is no FDA-approved vaccine yet, but several are in late stage 3 trials, and the CDC told the states the FDA could authorize emergency release. Pundits questioned the CDC's call for election eve readiness as a premature and political move.
Even though some people may be skeptical, all of us may have concerns about if that's really real or not. It could be an election ploy. The reality is for our own local government is we have to get ahead of the game. We can't keep reacting. It's not just about this issue. There are many issues that we're just playing catch up on.
The CDC instructs state officials to outline priority recipients, which providers will administer it where and when, and even how and where doses will be kept. The state's COVID-19 Joint Information Center told KHON2 mass vaccine distribution will be complicated with many variables like refrigeration, shelf life, dosage, and delivery. Several counties told me they're deferring to the Department of Health to manage planning for the entire state and stand ready to work with them on a distribution plan. The Hawaii Emergency Management Agency says it will support the health department in developing the vaccine distribution process. Some say HIEMA and the Hawaii National Guard would be better to take the lead.
General Haro was put in charge of as incident commander for a reason. What he is good at is logistics, planning, implementation, creating benchmarks, follow through. Leave the technical and medical expertise to Department of Health.
Infrastructure that has sprung up beyond the health department for other components like contact tracing and testing may also be a fallback.
We just have to have the right leadership call, and you just got to push the button to say, go ahead and let's do this.
Gina Mangieri, KHON2 News, Always Investigating.